So, depression has really been a big issue in our community. Um, we are seeing it more and more people being affected with depression, especially with COVID-19. And most people really don't know where to turn to. And we are hearing cases of people committing suicide, people, because of it is already an issue for people who have depression, but it's also now a big issue because they have depression and there's COVID. There are other stresses in the community that are affecting them, and that's why we are doing the show. Welcome to Dr. Pam Obare Mugaka Show, and today our topic is about depression. Let me tell you something about depression. The biggest problem we have with depression is understanding the disease. Once we have the grip of the disease, what it is, and how it affects families, it's going to be easy for us to tackle this issue. Depression is just a disease like any other disease, like diabetes, like high blood pressure, like HIV. It's chronic, it's continuous. It has its challenges up and down. Once we come to the grips that depression is a chronic condition, that the patient, the family of the patient, and the community of the patient have to understand it in order for the patient and the doctor of the patient, they have to come together and understand the condition. And then it's going to be easy for us to treat it, for the patient to be able to trust people. It also starts with the patient. Understand the patient himself has or herself has to understand that they have this condition. But sometimes if the patient doesn't understand they have this condition, then the family have to come in to understand that the patient has a condition and they need help, they need support. That is very big. Once the patients understand and once the family support understand, then now we look for support. And there are resources in the community for people with depression. There's a lot of resources in our community. Also, they need to be seen by a psychiatrist, a psychologist. They need to evaluate them to understand what kind of depression they have, what triggers, because sometimes this is triggered by different issues in life, what triggers the depression. And as any mental illness, depression, schizophrenia, this has to be treated to a specific person. There are people who have depression and one medication works for them and another medication doesn't work for them. So it is important to work with their psychiatrist and their doctor in hand. Sometimes, like now as we talk, during COVID-19 2020, the psychiatrists have like 3 to 4 months appointment. Stress level has gone high, anxiety level has gone high, depression is going high. So it is, the waiting is high. So even as a patient who knows they have this issue, it is easy to talk to their primary care. Say, I've been taking Wellbutrin, or I've been taking Lexapro, or I've been taking this medication. Can you prescribe for me before I can be able to see my psychiatrist? So it is very important for the psychiatrist to for the patient to understand, so that it is easier for them to tell their doctor to help them. So somebody will ask then, what are the signs and symptoms? Because there are people who actually don't understand that they have depression. I'm going to share some of the signs and symptoms. These are not all. And obviously, I am just giving information. I am not giving you treatment. So you have to go seek medical treatment from your doctor, from your psychiatrist. This is information I'm providing for the community. So some of the reasons is that a patient is very fearful. They fear that something bad is going to happen in their lives. That's one of the signs and symptoms. They are very tearful, they cry. Some of the patients, they stay away from activities that they like. You know, like if they used to like coming to social media, they don't want to come to social media. If they used to like going for walks, going out for dinner, they go away from all those activities that once they used to love. The other one is guilty feeling of unworthiness. They feel like they are not worth anything. You know, somebody feels hopelessness. They feel like they don't belong. They feel like the world is everybody is against them. So the feeling of hopelessness also makes it so difficult for them, because they cannot function. Some of them, they start giving away their clothes. Some of them, they start giving away their possession, things that they love to give, they don't want to. So like if you have friends and you know they are very active, sometimes, let me tell you something, they can actually put a picture on social media, and if they don't even have one like, or somebody doesn't even, that can set them up. That can set them up for depression. The other thing is that their concentration is diminished. They don't concentrate as well as they are supposed to concentrate. They don't make decisions well, especially when they are in the manic stage. That's why sometimes you hear somebody did shopping, bought things for 10,000, which they don't even have, or 3,000, which they took the credit card, bought things. And I have one patient was telling me that she was in the manic stage, and she had just gone and bought, things worth 3,000, which they did not even need. So also some have weight loss, some weight gain. Some people gain weight because they stay indoors and they eat a lot. Some don't eat at all, because when they get into the depression stage, because it's either they are on manic stage or they are on depression. When they are manic is when they buy stuff, they do stuff, some act out sexually. But when they're in depression stage, this is the time now they don't want to get out of bed. They're sleeping, they are staying in bed. Somebody locks themselves the whole day, 2-3 days they're sleeping in bed. That is when they are in depressed mode. And this is the time they need the family. Both occasions, they need the family, somebody to intervene, somebody to check on them. Hey, we haven't seen you. What's happening? Can you come out? Or can we get intervention for you? Can we get somebody to help you? So it's very important for families to be involved. And let me tell you, it is very difficult for families because it's draining. The other sign and symptom is that sometimes they have those thoughts, suicidal thoughts, every time they're thinking about suicide, death, things like that. So that is when they are really depressed. And sometimes they're agitated. There's agitation. They just can be, they can be ticked by something small. So when you see all these symptoms I've said, diminished interest in activities, fatigued, they're very tired, insomnia, they want to sleep all the time, they are guilty feelings of worthlessness, hopelessness, they have concentration very difficult, they can't make decisions very well, there's those suicidal ideations, suicidal thoughts, agitation. When you see all these symptoms, then you need to help these patients so that they can get help. The most important thing is to get help for the patients. Once you get help for the patients, then the rest can be history. The rest they can work with that. One thing I also want you to understand is that people who have depression, sometimes it is genetic, sometimes it comes from nowhere. But there are some families that have bipolar. There are some families that have this this these tendencies of getting sick or having this kind of disease. And what I've dealt with families that accept, they know that I have children, 2 of my children have bipolar, 2 of my children have this. It is difficult, and these patients and these families, they need help. They need, especially people in Africa where we don't have enough resources. Sometimes people don't know, sometimes people want to lock somebody down because they have mental issue. This is something that can be dealt with, even if they don't have enough help. With the globalization, there is resources online. You can go online, you can Google. We have our groups, mental health issue groups. People who have their own groups that deal with, they even have specific groups for black people, for white people. So you join these groups, you'll get people who will also share how they deal with these issues in their lives, how it can help you. And that is really big. The other thing I wanted to discuss about is that the mental health medications for depression, it is one of the mystery. Even psychiatrists, they find it so difficult to find a medication that fits for you, for one person. So it's gonna take up to 4 to 6 months, sometimes 3 months, 4 to 6 months for one medication to be proven, to be known that actually it is working. So when you get your medication, please make sure you take your medication as directed. At least it is not like a pain medication you take in 5 minutes, it's already kicked in. Medications for mental health, because it has to go to work with what is in the problem in your head. Because some work in that junction where where the epinephrine or serotonin, because the serotonin in your level in your head or in your brain is not working as well as other people. So this medication is given so that